We are covering dental and vision insurance plans, a topic you will encounter on the health insurance licensing exam. For dental insurance, the exam will test your knowledge of how services are categorized. These categories are preventive, basic, and major, and they determine the level of coinsurance. Preventive services, like routine cleanings and x-rays, are often covered at or near 100% because they help prevent more costly issues later. Basic services address common problems like fillings or simple extractions and are typically covered at around 80%. Major services are for more complex and expensive procedures like crowns, bridges, and dentures, with coinsurance usually around 50%. Expect exam questions that require you to identify which category a specific service falls into. A common trap is confusing the coinsurance levels, so remember the 180-50 split as a general guide. Dental plans also have an annual maximum limit, which is the most the insurer will pay for services in a benefit year, typically ranging from $1,000 to $2,000. Once this limit is reached, the policyholder is responsible for all further costs until the plan resets. In contrast, orthodontic coverage for things like braces usually has a lifetime maximum, a single amount that, once exhausted, does not renew annually. A key exam point is distinguishing between the annual maximum for general dental services and the lifetime maximum for orthodontics. Another critical concept frequently tested is the waiting period. While preventive care is usually available immediately, there are often waiting periods of 3 to 6 months for basic services and up to a year for major services. This is to prevent individuals from buying insurance only when they need expensive work done and then dropping it. Vision insurance is simpler. It primarily covers routine eye exams and provides specific dollar amount allowances for materials like frames and lenses. For example, a plan might offer a $150 allowance for frames. If the insured chooses frames that cost $200, they pay the $50 difference. The exam will focus on your understanding of how these material allowances work, not on complex vision procedures. To remember the dental service categories, use this phrase: prevent problems before major trouble. Prevent for preventive, problems for basic, and major for major services. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.